Welcome to another episode of DrillDown Dialogue. I'm Stephen Nance, CPA Vice President of DrillDown Solution, and I'm here today with the one and only Ben Tuinei. How are you, Ben?
I'm great, Stephen.
For people who are well connected in the dental industry or people who are proactive about managing a PPO practice, your name is well known. But for those who don't know you, tell me just a little bit about your what you do, and then let's just dive into kind of your background, how you got into this and what you did professionally before.
Yeah, absolutely. Thank you. Thank you for that question. I always still think of myself as a small time person in dentistry. I don't think I've scratched the surface in terms of impact just yet. But thank you for that comment. So been in dentistry since 2007. I was sort of hired as the vice president of payer relations, which is a glorified name for a DSO that's hiring somebody to negotiate with insurance companies and
Hmm.
manage revenue cycle. And that's my experience in dentistry is all things insurance. And within just a few months of being hired by this DSO, I recognized that there was a need in the industry that wasn't served, that did a service that didn't exist at the time. And that was this negotiating with insurance companies, because that's what I was hired for. And I thought, oh, they're hiring me to be the leader of this department. And when I put out advertisements to hire support team members that had relevant experience, I got maybe 1,000 resumes, but zero actual experience with the whole realm of negotiating with insurance. So as I started to figure that out, Stephen, I realized that there was a business opportunity because, when you're working with a DSO, more than half of the associate doctors have their own private practices,
Hmm.
or they may be a partner with one location at the DSO, but have a private practice separately in a rural community
Yeah.
far, far away.
Okay.
And those doctors came to me and said, wow, I had no idea that I was getting paid more. And when I started to ask questions to the managers, they said, well, the reason why you're getting paid more is because we've negotiated your fees to be 30 to 40% more than what we were getting before. Naturally, if you're a practice owner, as an associate working for a DSO, you're going to ask questions. Well, how can I get that at my own practice?
Yeah, yeah.
And that's really what started my path in terms of looking at dentistry as a whole. And I was looking at this more so from the perspective, how do I create a new category of services? How do I create something innovative that's new that helps the industry become better? And negotiating with insurance is the calling that was naturally given to me as I was looking at this from my employment experience. So in 2009, I decided, what, there are no businesses in dentistry to address this need because it's apparently a very big need in the industry. So I started a business.
Okay.
And humbly, 10,000 doctors later, we're now in 2026. In terms of really trying hard to spread the awareness that yes, your PPO fees can be negotiated, but it's not something that insurance companies are going to willingly give up. There's a process that you have to go through to get the insurance companies to comply with a sort of a fairness rule in giving you fee schedules that are commensurate with your skill set, right? Or at least
Hmm.
fee schedules that are commensurate with the quality scope of what the industry wants to give the public anyway.
Hmm.
So that's where we're at today. I started this
Okay.
wild idea as an employee and then turned into an owner of a business and here we are.
So you started with that DSO in 2007, you said?
Yes,
And
that's right.
then when did you start your company?
September 2009.
2009. So fast forward to today, and particularly in the last 5, 6 years post COVID,
Mm-hmm.
we've seen, dental practices are their labor costs are through the roof, and there's been probably a bigger push to go fee for service because people are recognizing um, the reimbursements from PPO insurance is just not keeping up. Um, you would think that the insurance companies would pivot or recognize some of those trends and start reimbursing more. Are we seeing any of that, or is it less? Is it stagnant? What's kind of the state of the industry now?
I love that question. And the answer is it's a bit complicated. So I'm going to break it down into two different answers. Number one, I'm going to answer on behalf of the insurance industry.
Okay.
Um, and I know I'm going to field some lawsuits for what I'm about to say next. but here we
Well,
go.
that's not my intention, so you don't have to say anything you don't want to say.
Oh no, I'm not afraid of the insurance companies. I have a very healthy and knowledgeable legal department. But what I want to say is a distinction of indemnity. You know, this my comments are not representative of Steven's podcast. This is Ben Tuinei's opinion.
Thank you. I
Um,
appreciate that too.
so the insurance industry looks at these fee increases as a threat. You know, when you look at any stocks or
Mhm.
Roth IRAs or any investments that you do with a broker, a lot of the investments are with the insurance companies that are out there. You know, I'm not going to name any names, but you look at your portfolio that's
Mm.
being managed by somebody else, you'll see a lot of insurance companies in there.
Mhm.
Naturally, when you look at the insurance companies and ask the most important question as it pertains to clinical dentistry or clinical medicine, who do the insurance companies have a fiduciary towards? Who are they responsible for making happy? You know, it's
Yeah.
not pay, and sadly, it's not the outcome of patient care.
Right.
It is the outcome of investments. How much
Right.
of a return on investment that you can give to your investors
Right.
and shareholders. And sadly, that's just the reality of insurance as a whole, is that they are not focused at all, dare I say at all. They're not focused on what the clinical outcomes are. They're focused more on what will appease the shareholders, right?
Mhm. Mhm.
Um, and so when you look at it from that perspective, and now when you look at it from the doctor's perspective, yes, we are getting fee increases. We're getting record level fee increases that the insurance industry
Okay.
has never offered before.
Okay.
And it's mostly because, like what you mentioned with regards to doctors wanting to go fee for service, that is the model to pursue. It takes time to get there. It takes a
Yep.
lot of education and training to get there and maintain that model successfully. But I agree with you that that is the model that everybody should aim for. You know, everybody should aspire towards being fee for service. And here's why. When you look at just the last 5 to 6 years, Stephen,
Mhm.
when the pandemic started, a lot of doctors, because of the stress and pressure of wage increases
Mhm.
that their own employees were demanding,
Yep.
the doctors started to recognize that the in-network status just didn't cut it from a financial perspective. And most doctors didn't do an analysis to go out of network. They just did it. And
Yeah.
they tested it on their own. And naturally, their success was like a sneeze effect. Everybody got the out of network flu. Not everybody took action to go out of network, but you had a decent number of doctors do the same thing.
Mm.
So when you have a wave of doctors that are going out of network and the insurance industry resisting fee increases, now the insurance industry, you know, pick any insurance company, they lose market share because so many doctors go out of network. And I've been told that when a doctor goes out of network and I'm an employer in that area, I'm supposed to know. I'm supposed to know and get a list of who's going out of network so that I can at least
Mhm.
notify my employees, oh, these doctors are no longer
Mm.
participating with the health plan that we chose or the dental plan that we chose. And
Mm.
because these insurance companies have had to send hundreds, if not thousands of those notices in a single year to the
Mm.
employers that they represent, imagine what that does to the employers in terms of their mindsets. Like, oh,
Yep.
why are these doctors going out of network? And the employers, and I know this to be true because I've actually talked to the employers and I've asked them, what do you guys think? Like, what as an HR professional, what do you think when you get these notices of hundreds of doctors leaving the network that you have?
Mhm.
The all these HR employers say, sorry, HR professionals say, we're concerned. because what that means to us is that this insurance company is doing something that is causing the doctors to protest,
Hmm.
to sort of um, protest by the way of going out of network. And we hear it now. So we've canceled this plan and we moved to this plan, and it's the same. You know,
Hmm.
this new PPO plan is sending us the same amount of notices every quarter of how many doctors are going out of network. And I'm sorry I'm going along with this answer, Stephen. So
Oh, that's great.
the perception among the dentists is that we love it because those that are choosing to stay in network, we're seeing breakthroughs with PPO plans that historically have not negotiated with solo practitioners. And those are starting to surface in so many states. And that part of the insurance companies, the ones that don't negotiate, the reason why they are negotiating is they're trying to retain providers. It's no different than when you try to
Yeah.
cancel DirecTV, Sprint, Verizon, or any cell phone carrier or
Mhm.
TV cable company. There's a retention department that's designed to give you a little bit of a break so that you'll
Yeah.
stay, you know?
Yeah.
And that is exactly what's going on in the industry right now, is that we're seeing fees being corrected, not to the tune that we want them to, but they're at least being corrected by some level of
Yeah.
increase. And that is not it is not causing a level of happiness among the insurance companies, but it is among the dentists that are doing the hard labor to deliver clinical dentistry.
Yeah. Well, I guess that's a little bit of good news that there is some correction happening. Is
Yeah.
that correction, um, is it, I mean, you mentioned the comparison to a retention department with phones and with phone carriers or cable or what have you.
Mhm.
Um, is it similar where it's maybe a little bit of a bone, but it's they're really kind of trapping you into maybe more problems down the road, or are they giving some big enough incentives to maybe it's worth not going fee for service?
You just opened up a new can of worms. You ready?
I'm ready.
So, um, so what the reaction among the insurance industry is actually really interesting. They think we don't pay attention to this stuff.
Yeah.
So what the insurance companies have already started doing is in their recredentialing packets, they're now starting to include, this is every insurance company. They're now starting to include language that says you agree to the set fees that you're assigned now, and you also agree to not have an increase for a couple of years.
Oh,
Oh,
okay.
and also you agree to not terminate your contract within these couple of years too. So by
Okay. Okay.
by reattesting or recredentialing,
Yeah.
the insurance industry is trying to prevent doctors from negotiating by using tort law, contract law,
Okay.
and having contract language within your recredentialing that if you sign that, you can't get out of it. You are,
Mm.
and this is the part where, and I've been saying this since I started my career, because when I started my career, I had to credential a bunch of doctors, and I would put, those little arrow tabs on the signature pages. And this is back in the day when we didn't have like, DocuSign or the electronic
Yeah.
methods of signing things. You
Right.
literally go through every application,
Yep.
like every page one by one. And I was surprised at how every dentist never read anything. They signed, they signed, they signed. And I'm not saying this to shame any dentist listening to this today. You know the culture is that you hire a professional and you give your trust into that professional,
Sure.
hoping that that professional has read all these contracts.
Hmm.
And as a result, we do read them. And and when we read these contracts for the last 2 years, you agree to not negotiate, you agree to not terminate. So now you're stuck with a
I
contract that you
see.
can't even change for 2 years. That's how the insurance industry is responding, is they're
Okay.
responding to the part where historically doctors have expressed their grievance and grievances online about signing something that they didn't agree to, or enrolling with something that they didn't agree to. And the insurance industry knows that, and they're using that against the dentists these days. So
Okay.
that this is all more reason why you should read your contracts.
Yeah. Yeah. And that's easier said than done. Um,
Throw it into ChatGPT. Like use all
yeah,
these free AI tools
yeah,
out there.
yeah, there you
Yeah,
go.
yeah.
So the is 2 years what's the norm then with these new contracts? And then after 2 years, is it totally up for renegotiation, or are there other sticking points in these contracts?
Yeah, this is the fun part about contract negotiations is that when I'm involved, we strike out clauses. When you're dealing with any institution or individual or corporation that has a contract, um, everybody needs to know that contracts are always designed to be bilateral, right? Unless you get born into the United States and automatically you have a unilateral contract to pay taxes, right?
Hmm.
In the business world, contracts are designed to be bilateral, meaning both parties get to have input in that agreement.
Okay.
There are components within credentialing agreements that you have no say over as a dentist, which is maintaining a license in good standing, maintaining proper liability insurance, for worst case scenario, which we all make mistakes. So that's a legitimate argument. But outside of those mandatory things that would allow you to practice dentistry,
Hmm.
within any contractual relationship with anybody, especially the insurance industry, you have a say. And what I don't agree with is there's always been a lack of education on how to deal with contracts in dentistry.
Yeah.
And to me, that's sort of acceptance, the fact that the insurance industry has control over that. No, we need to get out of that mindset. And we need to
Yeah.
start to understand that in order for us to protect ourselves better, and by us, I mean the practicing dentists, the practice owners that exist out there, is that we have to take more control over the components of a PPO agreement or credentialing contract that have nothing to do with your license, right? For instance, limitations on agreeing to a set fee schedule, for instance. You should have control over when you should renegotiate that. In my opinion, if you negotiate properly, every 2 to 3 years is sufficient. When you look at
Okay.
inflation in dentistry, it's almost less than 1% in terms of fee percentiles increasing year by year.
Hmm.
And so when you look at renegotiations, heck, if you get a 30% increase this year, it's unreasonable to expect a 30%. I mean, it's nice to get a 30% increase in
Sure.
next year,
Yeah.
but if you do that every year, you're pricing yourself out of the market, right? Now
Yeah.
people don't want to do dentistry because it's overinflated, right? Too
Hmm.
fast.
Hmm.
So every 2 to 3 years to maintain with an appropriate level of inflation, in my opinion, in an effort to keep dentistry prices in a reasonable amount of control, where the insurance industry isn't going to protest the rapid increases that some doctors want to do, right? Like for instance,
Yeah.
going from $1,200 to $2,300 for a crown within a
Hmm.
2 year period, the public isn't going to accept that. So we
Yeah.
we have to think strategically in terms of how the insurance industry thinks about fees, but also what's considered fair in the market. The best place to go in terms of what's fair in the market for fees, Fair Health. Number one institution that I recommend. Not being employed by Fair Health or getting any compensation for mentioning them. That is the institution, in my opinion, that has done the best job at recommending where fees should be in every
Okay.
community that is appropriately set for negotiations, but
Yeah.
also appropriately set for the public, to be fair
Okay.
on all sides.
That's great. Now you still recommend that everyone work toward every dental practice work toward becoming a fee for service. Did I hear that right?
Oh yeah, 100%. Yes.
And is that possible then in every demographic?
Oh yeah. So I've been conducting a study with the California Dental Association, but
Okay.
I've also been following studies from a lot of CPAs around the country that have been tracking these numbers for a
Okay.
couple of decades now. And what I've seen is like in California, the average rate of retention a year and a half after you're out of network with Delta Dental is
Hmm.
81 to 82% retention. And,
Awesome.
and that equates to a 23 to 27% increase in overall Delta revenue.
Mm.
So roughly 20% less busy, but you're earning 20 to 25% more in revenue.
Okay.
So
Yeah.
eh,
Well, that's a win-win there.
the key is maintaining it. because if you don't
Right.
have marketing to replace
Yes.
the fact that, you don't get all new patient opportunities when you go out of network with that plan, because not everybody wants to go out of network. If you can maintain out of network, which not every practice does successfully,
Yeah.
if you maintain out of network with being able to have a mechanism to drive new patient flow from the perspective of being out of network, fee for service works great. So in my current assessment, roughly 80% of the practices that we follow, they never need to that have gone the fee for service route. 80% of them never need to go back in network because they master retaining patients, but they also master the part about attracting new patients in from that glorious out of network perspective.
Yeah. So how about a de novo practice? Depending on the demographic, do they need to start taking PPOs and then transition to a fee for service, or should they go straight into fee for service? Is there a strategy to that?
I love where you're going with these questions. What comes to mind in terms of de novo like startup practices is Dr. Kim Nickel up in Park City.
Okay.
Um, she she opened June 2020
Oh man.
when everything was shut down. Um, and she was a start from scratch,
Yeah.
no zero patients on day one. We looked at what the Utah dynamics called for is we joined the PPO plans that everybody else in Park City, every other dentist in Park City was participating with. But Dr. Kim is such a socialite. She is so friendly and warm, and she is a networker. She joined
Okay.
the Chamber of Commerce and she went out on her own, and within no time, Park City is full of celebrities.
Yep.
So she had all these celebrities coming to her practice. And
Mm,
that's because she went out and procured her own patients
yeah.
through these very high level meetings that she would go to. She had the personality to do that. Not everybody does in dentistry,
Yeah. Yeah.
most doctors in dentistry, I think I have a very similar personality to the typical dentist, right? We want to get educated on how to do a skill.
Hmm.
Um, and we don't want to worry about the business components. We want people just to come in so that we can perform what we love, right? Our skill set. Everything else is just noise. And I don't disrespect that mindset because I respect what doctors do because it's stressful, it's hard,
Yeah.
it breaks your back, quite literally. But what Dr. Kim did was she looked just with her natural abilities. She looked at her own business from the perspective of I'm going to join these PPOs reluctantly. I've never done that because she came from Kentucky where she was fee for service, but she
Okay.
joined PPOs in Utah because she thought that that was the way to go.
Yeah.
Within 1 month of her opening, we both decided you need to go out of network with everybody that you joined. People are
Wow.
coming to you not because you're in network, they're coming to you because they like you.
Yeah.
And you don't need insurance to drive down your fees because you're naturally getting people that are coming to you not because they're in network with their plan. So she went out of network immediately with all PPO plans. You know how many patients she's treated in her first year? Like 12 months during a pandemic where everything was shut down,
Hmm.
1,500 patients.
Wow. Wow.
So if you have a networking mentality and you have a knack for making friends and you're willing to go out there and be social, like what Dr. Kim did, I've noticed that there are a lot of dentists that have that personality. So
Yeah.
being fee for service from the get-go is safe when you are getting your own patients, right? But me as if I were a dentist, I would actually go in network because I'm not that kind of person. I'm very shy as an
Mm,
individual. I would join PPOs because what's the first question that people ask when they call a new practice? Are you in network with Delta Dental? Are you in network with Aetna, right?
yeah.
And when you say no to that, you lose a lot of opportunity, right? And I look at when I'm a de novo, startup practice, I look at my chair time as a hotel. If I don't have somebody in that room, I'm losing money for that day, right?
Right.
If I
Right.
have somebody in there to at least offset my overhead and I don't make money, now I don't have to pay for that empty chair time or empty
Right.
hotel room, you know?
Yeah.
So if I didn't have a marketing strategy that was strong enough to be fee for service, I would join PPOs with the intent to go out of network in a few years.
Got it. Okay. That's really helpful. So do you provide consulting for practices that want to go fee for service, or are you strictly focused on negotiation?
Yeah, I do both. Sadly, I shouldn't say this sadly. I recognize a lot of professionals in the industry do a great job at coaching doctors to go out of network, and I refer out
Okay.
most of the time. But I do know how to coach doctors on how to go out of network. And
Yeah.
I only am, well, where I am helpful is when the marketing is great already and the customer service is already great for that practice where they don't need individual coaching and individual sort of influencing of team members to be better, you know, or replacing team members. I don't do any of that. um,
Yeah.
if everything is jiving in terms of marketing, there's a healthy amount of new patients coming in that's consistent, and the team members themselves are sold on going out of network, and they all perform at a very high level already. I can help with the instructions on going out of network, right? And the instructions are very simple that if you have the other dynamics that I mentioned perfected, out of network with very simple coaching is very easy. But if you're not at that level, I highly recommend getting with professionals that can help you with boosting up your new patient flow because when you go out of network, the last thing you want to do is be complacent and not focus on the new patient flow, right? And then, of course, team member training dynamics. I mean, I can get away with training team members, but I'd be dishonoring the hundreds of people in dentistry that I know that know how to train, and that's a key component because the number one reason why people leave is not necessarily because of fees. It's mostly related to the whole customer service component of the practice. Do I trust you enough, right? Have you done enough for me to trust you? And it's not just the doctor or the hygienist, it's everybody in the practice that has to be at their A game in terms of influencing people to think, I'm going to stick with you and pay more, even though you're going out of network, because I believe in your quality. Which, in a roundabout way, what they're saying is, I believe in the quality and I love your customer service.
Yeah.
That's how I interpret why people stay at a dental practice when you go out of network, right? So you have to think about all those dynamics in terms of going out
Yeah.
of network. If you're there, I can help you in terms of the two big areas. If you're not, then don't be discouraged. But I can definitely recommend, and you can too. We
Yeah.
both know a lot of professionals in that space to
Yep.
help practices and doctors get ready for when going out of network is the right time.
Yeah. Well, great. This has been an excellent discussion, and I know there's so much more you can say about these things. Um, Before we wrap up here in the next couple minutes, is there any main punch point that you didn't get a chance to say that you want to leave the listeners with?
Oh, Stephen, you've been so kind to give me so much time to talk. you know, I think, the last thing I'll mention is that every practice is different, and your practice is sort of a mirror of your personality, your mindset, your visions, your missions, your values, Don't measure yourself against the success of other people that are out there.
Yeah.
I'm a big believer of using other practices and other individuals as a roadmap, but
Hmm.
you have to sort of craft your individual approach, especially when it comes to insurance, right? It's
Yeah.
never a one size fits all in the industry. You have practices and practice owners that do Medicaid and their profit margins are 40%, and there's an ethical way to do that, and so if you're struggling, best thing I can recommend is network, talk to professionals.
Yeah.
Everybody these days are willing to do free consultations.
Hmm.
For insurance consultations, never just talk to one, talk to multiple people because the beauty about insurance is that everybody has different opinions and you'll resonate with the ones that you're comfortable with, right?
Yeah.
And I'm not talking myself out of a job. I just want to be fair with people in the sense that, you
Yeah.
know, you have to do your due diligence to find an educator or service that you resonate with a philosophy that fits yours, you know?
Yeah,
So
yeah. Well, thank you for that. So, Ben, if people do want to learn more, what's the best way to get in touch with you?
thank you for that invitation. Visit our website. It's veritasdentalresources.com. Veritas is spelled Veritas, then dentalresources.com. You can give us a call, 888-808-4513. Or you can email me personally. My email is just ben@veritasdentalresources.com.
Excellent. Well, Ben, it's been an absolute pleasure. Thank you so much.
My pleasure. Thank you, Stephen.